I'm going to take you through how to inspect your lower limb for lymphedema. Depending on what surgery you've had, you may be at risk of lymphedema in both legs or just the one leg. If you're at risk in both legs, it can be a little bit tricky. As I go through the video, I'm going to be talking about comparing sides. This is relevant if you're only at risk of lymphedema in one leg. I recommend that you inspect your legs regularly so you can monitor for any signs and symptoms of lymphedema. If you're already getting signs and symptoms like heaviness, ache, pins and needles, or visible signs of swelling, you do need to go and see a lymphedema therapist as soon as possible. Please note, you can get lymphedema in your genitalia as well as your legs. So the first thing we're going to look at is a test called pitting edema. So this is where you will hold your thumb in and you'll press firmly but not painfully into your skin, and then after 30 seconds you let go. If the skin bounces back, fantastic. If you're left with an indentation or a bump, that's an early sign of lymphedema and needs to be assessed by a medical professional and a lymphedema therapist. Now, with this pitting edema, you can do it at various places up and down your limb, including the top of your foot. Now we're going to inspect, starting at the feet and working our way up. There is a test called the stemmer sign. So this is where we pinch the skin, and can you see that I'm able to pinch the skin with my fingers on both feet. If you're unable to pinch the skin at the top of your feet, this is called stemmer sign and can indicate lymphedema. So this would call for you to go and see a lymphedema therapist for a checkup. We're now going to have a look at your toes. Do your toes look fat? Looking at the top of your feet, can you see the tendons clearly? Here I can see my tendons. As I wriggle my toes, I can see the tendons. So are you able to view the tendons at the top of your feet? Please note, if you can't see the tendons on the top of your foot clearly, that can be an early sign of lymphedema. And then looking at the shape of your ankles. Can you see your bony, knobbly ankles? Do they look the same on both sides? Another thing you can monitor regularly is just the shape of your legs and monitoring the way, starting down at the calf, do they curve the same on the outside? Are they starting to look different? Can you clearly see your kneecaps or they're becoming obscured because there's a little bit of swelling? You could even look in the mirror, at the back of your leg, just getting to know what looks normal for you. The back of the knee, do the creases look different because you've got some swelling there? Monitoring regularly, the shape of your thighs to see if it looks like some swelling is accumulating. So you can be looking at whether, you're getting a bulge on the inside or the outside that's not related to growing some muscles. Please note, if you have any signs of genital lymphedema, it is treatable. Don't let embarrassment hold you back from getting treatment. In a previous job, I would treat it and I found it very fulfilling because it made such a huge difference to the quality of the life of the person involved. So your lymphedema therapist will not care, they will just be overjoyed to be helping you.